COVID-19 cases have been spiking this summer in the Northern Hemisphere, and while they appear far less severe than the infections over the past few summers, health pundits are calling for caution and good personal hygiene. So what are the latest COVID-19 tallies telling us? How are health experts explaining the recent rebound? And is COVID-19 becoming a seasonal illness? Welcome to Issues and Insiders. Today, we touch upon the recent resurgence in COVID-19 cases here in the country, as well as over in the US. For more on this, I have Dr. Arirang at MizMedi Women's Hospital, live on the line, who is joining us virtually from Seattle today. Right, Dr. Dan?
Yes, I am.
It's a pleasure to have you on.
Thank you for having me.
I also have Professor Monica Gandhi at the University of California, San Francisco with us. Professor Gandhi, it's good to have you with us as well.
Thank you so much.
Dr. Dan, let's begin with details about the latest surge in COVID-19 cases here in Korea. What are the related tallies telling us?
Right, so the current situation with COVID in South Korea seems to be very similar to the surge that happened last May, so about 2 months ago. But we do seem to be on track to surpass the number of cases that were seen in May. So from last week's KDCA report, there was a 50% week-on-week increase in new cases in the age 10 to 19 bracket. So that's students mostly. And then from this week's KDCA report, they showed a 44% week-on-week increase in new cases in the age bracket for people age 60 and above. Fortunately, there has not been a spike in deaths due to COVID during the last month. That is certainly good news, but ICUs are starting to fill up. And the concern is because there are more people who are elderly, who are getting sick with COVID. For the last 2 weeks, the total number of cases who are age 60 and above exceeded 100,000. There is the risk that there may be more severely ill and potentially fatal cases of COVID in the weeks to come. That's certainly what happened last January. That is the last time that we had a big surge in cases in this elderly population. And so we want to do everything we can to prepare for that possibility. It doesn't seem like there's a deficiency of ICU rooms or healthcare capacity right now. And the KDCA is making preparations for a surge in need for ICU care. But overall, because healthcare capacity does seem to be poised to deal with the surge, the overall risk for COVID-19 for the entire society is still low.
Right, I see. Professor Gandhi, I understand a similar scenario of resurgence is being witnessed there in the US as well. How severe is the surge there?
So it's not if you divide it in terms of severe disease versus cases. And I think we're just going to have to live with the fact that COVID-19 is not an eradicable infection, very unfortunately. Just the simple way to put it is it's in animals, even there's lots of other reasons, but because of that, we'll never eradicate COVID. So we're going to see, depending on if there's a new subvariant, in this case, we have XBB 1.16 in this country, and now we have the rise of something called EB5. These are all within the Omicron family. They can be more transmissible and we'll see more cases, but what we're not seeing is a rise in severe disease, and that's really hospitalization and deaths. Our overall rate of immunity in the population is very high. There was a CDC report that as of the end of November 2022, so fall of 2022, 96.4% of Americans had antibodies to COVID-19. These are called anti-spike antibodies, so it's either from vaccination, infection, or both. So with that degree of immunity, we're going to see cases. We are, as subvariants come along. But hopefully what we're doing is keeping the amount of severe disease low. And the way to do that, and this is really important, is those who are still at risk for severe disease, which are mostly elderly and people on immunosuppressants. They're the ones we have to watch out for. They're the ones that we have to boost regularly with another vaccine dose, and also use treatments like Paxlovid if necessary. One thing about the boosting is someday we're going to get to a seasonal once-a-year boosting for older people, but while we're still settling into that seasonality, it's likely that we're going to encourage older people to get boosted when there's a surge.
Right. And before we delve into vaccination and boosting, of course, Dr. Dan, how do you explain this latest rebound in COVID-19 cases here on the local front?
Right. So when we want to explain the epidemiology of what's going on with an infectious disease, we usually look at what's going on with the virus, what's going on with the environment, and what's going on with the host. So in terms of the virus, as Dr. Gandhi mentioned, the dominant strain around the world, certainly in South Korea and the US, is XBB.1.16. Also in South Korea, there's XBB.1.9.1 and XBB.1.9.2. In terms of the 1.16 subvariant of Omicron, the WHO has characterized this subvariant as having antibody escape properties, having a growth advantage compared to other subvariants. And fortunately, though, in terms of severity and clinical significance, it does not seem to be causing more severe disease compared to other Omicron subvariants. So what this means is we should expect breakthrough infections and reinfections, and that's certainly what we're seeing in South Korea right now. In terms of the environment, as was mentioned earlier in the broadcast, South Korea has been seeing alternating heat waves with torrential rains, and this is all pushing people indoors for their activities. South Korea, especially the Seoul metropolitan area, remains a very crowded environment, especially the subways, long-term care facilities. Many of them still have multiple patients per room, so that makes it very easy for viruses, respiratory viruses, to spread. We call that nosocomially, so within a hospital or healthcare setting. And so this is the environment that sort of promotes the spread of respiratory viruses. And then in terms of the host, the bivalent booster uptake rate among people who are age 60 and above is really only about 34.5%. And for the entire adult population, everyone 18 and above, it's half that. It's 15.6%. So people's immunity is definitely waning right now, and that makes people vulnerable to getting reinfected if they've had COVID in the past, or if they had the bivalent booster and it's been several months and their immunity levels against infection are low right now. And so that's why I think that's one of the factors why we're seeing this surge. And then, of course, host behavior. So everyone is doing everything that they had waited to do that they couldn't do during the pandemic. So they're gathering, weddings, parties, celebrations, traveling. This is all happening at full tilt. And of course, these kinds of activities can set up for surges. They can be super spreader events. And so I think there's a good explanation in terms of what's going on right now.
Right. And Professor Gandhi, would you also say that public activity is to blame perhaps for the resurgence there in the US?
Well, it's true that we're back to normal here in the US as well. I think that it's very rare for people to be wearing masks indoors. Some do. And I think that, the pandemic was declared over by the World Health Organization on May 5th, 2023, and the US declared the end of the public health emergency on May 11th, 2023. And that wasn't premature. That was really the pandemic phase. What is a pandemic phase of a virus? It's when things are difficult in terms of hospitalizations. There's an increase in respiratory deaths above the respiratory virus deaths above the normal. We are now back in the US, back to the same rate of mortality from respiratory viruses that we were prior to the pandemic. And that is good news. That means that the virus, COVID-19, has settled into one of many respiratory viruses that affect human populations, but we're out of the pandemic phase, and what we're into is the endemic phase. And what do we do in the endemic or the control phase? We figure out ways to keep those who are more vulnerable to severe disease safe. But the world is not going to go back to restrictions and to capacity limits and to indoor masking. It's not going to happen. And the pandemic being declared over was a very deliberate move by the World Health Organization to say we're going to have to live with this virus.
Right. Doctor, then moving ahead though, do you suppose the rebound here in Korea is a cause for concern for people like me who have yet to have contracted COVID-19, do you think?
Well, I'm assuming, since I've been working with you for the last 3 years during the pandemic, that you're healthy. So for a person who's young and healthy, especially if you're up to date on your COVID vaccinations, I don't think it's a cause for concern. But if you are elderly, if you're chronically ill, or if you live or work with people in that high-risk category, then there might be a cause for concern, because COVID, even though the overall risk for hospitalization, for severe disease and death is much lower now than it used to be, of course, 2 years ago, 3 years ago, it still remains a potentially fatal disease. We had 2 deaths among children, unfortunately, during the month of July. Another person in their 20s passed away just this last week. We are continuing to see deaths due to this disease, even among people who are young. And so I think, the risk is low overall. If you're healthy and up to date on your vaccinations, especially for you, the risk is low, but it does remain a potentially fatal disease. And so if you are in that high-risk category, you should be cautious.
Right, I see. Professor Gandhi, you've clarified then that the prospects of a COVID-19 lockdown is relatively low now. That being said then, Professor Gandhi, what are the chances of yet another pandemic occurring and then leading to a lockdown worldwide?
Well, this is a great question. I hope we're not going to have another pandemic for 100 years. Right. I mean, I will say, just to go back to what Dr. Don said, for people who are older, we were mentioning it, boosters and treatments. These are the biomedical advances we have to keep people safe who are still vulnerable from COVID-19. So vaccine boosters, whenever we get the XBB booster, which we will sometime soon, I think, that would be very important for those who are older. And then the same with using treatments for those who are at risk for severe disease, and that would be an outpatient treatment called Paxlovid. In terms of another pandemic, we are at risk only because we're in this era of pandemic, in the era of pandemics, and that has to do with warming of the planet and also how we treat animals, which is not a good way to reduce the, we really should be reducing the risk of zoonotic illnesses. On the other hand, we are in an era also where biomedical advances are going to happen fast. We got the vaccine for COVID-19 on December 11th. Literally, the pandemic was declared on March 11th, 2020. Within that short of a time frame, we got a highly effective vaccine for COVID-19. So the mainstay of pandemic management is going to be the rapid development of vaccines. We do need trust. We need trust from people. I know in South Korea you have the trust. We don't have the trust in the US as at high levels in terms of vaccine uptake. And in terms of a lockdown, I don't think the world is going to be as open to a lockdown as they were prior to this. I think there's a lot of there were other effects of lockdowns, including effects on children with school closures, effects of other medical care, and I think it's going to be more likely that a rapid rollout of a vaccine help keeping the vulnerable safe, whoever's vulnerable from that pandemic, because it may be children next time and it may be older people next time. It depends on who's the most vulnerable, keeping them safe. But massive worldwide lockdowns, unless it's like Ebola and it's as transmissible as COVID-19, I don't see that happening.
Right, hopefully not, of course. Dr. Dan, do you suppose, keeping in mind what Professor Gandhi has said, do you suppose health authorities here should seek to perhaps launch a broader COVID-19 vaccination campaign as this particular virus looks to become a seasonal reality?
Yes. Oh, sorry. Go ahead. Oh, sorry.
Oh, so yes, I think we should revitalize our vaccination campaign. As I mentioned, for the highest risk group, people who are 60 and above, the bivalent vaccine uptake rate is only 34.5%. For people who are 18 years and above, it's half that. And so I think we do have more work to do in terms of getting people on board to get the bivalent booster. Even now, because it will be at least another 2 months before a XBB Omicron targeted booster is available. So I think we do need to do more work. Also, I think it's time to prepare and optimize for when that XBB targeted booster does become available. I think we need to do a better job with communication, with making the vaccine available, accessible, and just convincing people that getting this booster, if you are elderly, high risk, immunocompromised, that this will add to your degree of protection against COVID-19. COVID-19 is not going to go away. As Dr. Gandhi said, this is endemic. And so this is something that we need to do. It's not the pandemic is over, we don't need to worry about it. That's not the attitude that's appropriate for COVID-19, and the attitude towards vaccinations needs to be, let's stay on top of the game season after season.
Right, and staying with vaccines, Professor Gandhi, I understand new COVID-19 vaccines will be available in the US this autumn, but already pundits there believe the uptake will be low. Could you tell us a bit about the new vaccines and the reason behind the dull prospects?
Well, so the vaccine that's being encouraged by the WHO and the FDA has committed to will be the XBB 1.16 subvariant in the mRNA formulation of the vaccine. Now, 11.4% of our subvariants in the US are already something called EB5, so the virus does change quickly, but hopefully XBB 1.16 will still be the dominant strain by the time we get that new vaccine in the fall. In terms of the uptake, it's true that we also had a low uptake of the bivalent, lower than you had in the US. In South Korea, we had a lower uptake of the bivalent. It was actually in the 20s percent, but I think if we focus our campaign, like the World Health Organization has encouraged us to do so as of March 28, 2023, through their SAGE guidance, if we focus our campaign on those who are older, over 65, those who are on immunosuppressants, those with multiple comorbidities, that focused campaign of those populations needing the next booster will hopefully increase our uptake in the populations that need it most. I think telling the entire planet to get a booster in fall is not going to fly, and that's not at all what the WHO is recommending anyway. So I hope the US will focus their campaigning on those populations most at risk.
Right. Meanwhile, staying with COVID-19, we're moving beyond the current resurgence. Dr. Dan, new studies reportedly link a person's genes to his or her experience with COVID-19. Could you explain this for us?
Right, so there were two studies recently published that shed some light on the mysteries of who gets asymptomatic infection. So who gets COVID-19 infection but has no symptom, because that has been a mystery. And also who develops long COVID. We know that there may be some risk factors, but these studies really shed some light in terms of what's going on a genetic basis to explain these conditions and these phenomena. So one of the studies looked at people who were bone marrow donors, and that was the registry that was looked at. And what they found was there's a specific gene called HLA-B1501. And people who have this gene seem to have a higher chance of having asymptomatic infection, that this gene seems to mediate asymptomatic infection. And this is very interesting because, of course, up until this point, it was somewhat of a mystery. The other study shed light on who is more likely to develop long COVID symptoms. And the gene that was identified is called, the genes near a region called FOXP4. And what the researchers found is people who carry this version of the genes, they have a 60% higher odds for developing long COVID symptoms. And so I think these kinds of study findings will inform us in terms of where we should target our, say, vaccine development efforts, how we can manage and triage our patient care, and in terms of advising patient populations, how they can manage the disease going forward. Perhaps we can also use this information to develop new treatments for COVID-19 as well, especially with long COVID, because millions of people are still dealing with long COVID symptoms around the world. And so I think this is very interesting studies and findings that were recently reported. Of course, this is all very new and we need validation, and it's probably going to take many more months, maybe years, to actually develop some hard treatments and vaccines as a result of these studies, but it's very interesting indeed.
Right, I see, of course. Dr. Gandhi, Dr. Dan just mentioned long COVID. Now, a UK study has reportedly compared brain fog of long COVID to aging a decade. What more can you tell us?
So a couple of things about long COVID and the neurologic effects. I mean, one thing is that it seems that having lingering symptoms from COVID is really more common after severe COVID. And that observational study after observational study has shown that our rate of severe COVID has gone down with both vaccinations and infection-induced immunity, and hopefully with treatments and having more treatments available. So hopefully we're going to see the prevalence of the condition go down. In terms of the cognitive issues that happen with long COVID, it's still unclear what's going on because an RNA virus does not stay actively replicating in the body for long after the immune system swoops in and starts killing that virus. What can stay in the body are what are called retroviruses, like HIV, or even DNA viruses, like herpes DNA viruses that establish latency. And so we still have to figure out what are all the treatments to help people with these conditions. And the NIH just launched today a series of trials. This just happened today, for anyone who has lingering COVID symptoms. Please, at least here in the US, get involved with these NIH studies to explore a variety of treatments that could help combat these symptoms. One is Paxlovid. One is metformin, which is in this capacity, serving as an anti-inflammatory. And others are cognitive therapies or helping people through some of the difficulty with what's happening just through therapy and cognitive therapy and talking. So it's really important to get involved if you're in this condition in one of these studies if you can.
Right, of course. Thank you for letting us know. Meanwhile, Dr. Dan, one final question to you, a brief one. What are your words of advice to those who test positive this summer, which is also said to be the hottest on record?
Right. So first, don't panic if you test positive. I would call your closest community health center or 1339 and ask for advice. You can let the person who's answering the phone know, what's your age? Do you have underlying comorbidities? And they can advise you in terms of, should you start treatment? Should you start Paxlovid? In terms of respiratory etiquette, preventing the spread, if you do test positive, I would stay home. Don't go to school. Don't go to work, at least while you're infectious or if you have symptoms. And also, if you are very sick, there is a treatment called sotrovimab, which does still work against the XBB.1.16 subvariant. People who are very, very sick who cannot take Paxlovid for whatever reason, they may be eligible to get sotrovimab. So there are treatment options. But we do need to still be responsible and try to do what we can to prevent the illness from spreading, even if you don't have symptoms.
Right. Good to know, Dr. Dan. 1339 for those of us here in South Korea then, right?
Yes.
All right, then thank you very much, Dr. Dan, for your time and your thoughts. And Professor Gandhi, as always, thank you very much for your insights.
Thank you.
Right, well, on that note, we end this edition of Issues and Insiders. Thank you for watching. See you same time tomorrow. That is Wednesday.